Ananta, Raina. She'll be pediatric preseptal cellulitis.
Good morning everyone. Today I am going to present my case on pediatric preseptal cellulitis, unusual case following rat bite in hilly region. The 11-year-old male presented in with IOPD with chief complaints of painful marked swelling of left eyelids for 5 days, blackish mark on periorbital region and fever at presentation. History of present illness was that the patient was apparently well 5 days back when he experienced painful marked swelling of upper and lower eyelids when he woke up in the morning, which was sudden in onset, progressive in nature, which was associated with black scar mark on the lateral part of the upper eyelid. And upon instigating the patient, parents revealed the history of rat bite 11 days back, which was initially neglected. Then the patient was made visit to the local hospital, and they treated the patient with oral antibiotics, topical antibiotics and oral painkiller, but there was no improvement observed by the parents. So they rushed to the our hospital. Past medical history, patient had no significant past medical history. Personal history where patient was non-vegetarian and the rest was within normal limit, and family history was not significant. On general physical examination, everything was normal except the patient was febrile and pulse rate was higher. Ocular examination was done, in which it was found that the major findings were that in ocular adnexa of left eyelid, there was a significant lid edema, blackish necrotic wound laterally in the upper eyelid, which was tender and febrile. Ocular movements were full and free in all cases in both eyes, and particularly when pupil was checked, there was no sign of any RAPD, and rest was within normal limit. In conjunctiva, subconjunctival hemorrhage was seen, and these are the pictures of rat bite with necrotic wound and the periorbital lid edema and subcons hemorrhage in the left eye. The provisional diagnosis made was a left eye preseptal cellulitis. After that, diagnostic workup was done, in which then ESR was significantly high and imaging was done by using CT scan of left orbit. These are the CT images of axial scan showing hyperdense areas depicting soft tissue swelling in the left periorbital region, which was consistent with the preseptal cellulitis. These are the coronal scans showing the hyperdense areas of enhancement anterior to the orbital septum. Rest was all normal in left periorbital region. Diagnosis made was left eye preseptal cellulitis with rat bite. For this, management was done. Initial treatment was anti-rabies virus and TT was done, and then patient was admitted in the hospital with he was treated with injectable broad spectrum antibiotics, and for 7 days, and topical eye drops were given to the patient. Then oral medications were given. The wound was regularly cleaned, and lid hygiene was done. Regular follow-up was done to monitor for the signs of orbital cellulitis. These are the follow-up pictures of the patient while in the hospital admission. So such cases are generally unusual presentation. There is incidence of preseptal cellulitis due to rat bite, but it is very uncommon. It can be unique in hill areas due to increased rodent exposure and limited access to the healthcare. Complications, if we leave untreated, the patient can lead to orbital cellulitis, and vision loss can also be present. So I would like to recommend all the health care providers to maintain high index of suspicion and promptly mitigate the risk. Action was taken promptly, and the key takeaway is that the pediatric preseptal cellulitis can arise from uncommon causes like animal bites, or increased awareness is critical for timely intervention. We should emphasize necessity for thorough evaluation in any eyelid swelling, especially after animal bites. So in preseptal cellulitis, it is important that we treat the patient immediately and regress rapidly, so that the patient cannot go for serious consequences. Thank you. Thank
you. Any questions? This for the first time I have heard that rat bite leading to orbital cellulitis. Most of the times
Yes,
it's
sir.
the limbs that are attacked, but unusual case, but managed nicely with antibiotic. Obviously,
Broad
it
spectrum
was a rat bite,
antibiotics.
and orbital cellulitis it was a usual outcome.
Okay.
Any questions? Thank you.
Thank you, sir. Thank you.